In our last video, we asked the question, what is functional medicine? And we answered that by trying to explain really why we need it. This time, we're going to really answer that question using an example of one of the most common problems that comes to see us and practitioners like us, and that is an underactive thyroid or hypothyroidism. So here we have a very simplified diagram of how your thyroid and thyroid hormone works in the body. So the brain secretes something called TSH, or thyroid stimulating hormone, which stimulates the thyroid to produce T4, which then gets converted to T3, the most active thyroid hormone in the body. And then T3 will act directly on the cell to really ramp up what our body needs to do, ramp up metabolism, producing more energy, doing everything the cell needs to do on a higher level. So what will typically happen is when someone has a thyroid issue is firstly they'll start to develop symptoms of an underactive thyroid. Typically they're sluggish, fatigued, maybe they get dry hair, dry skin, struggle with weight, put on weight excessively and struggle to get it off. So they go to the doctor runs tests, maybe looking at TSH levels, T4, T3 levels in the body, and if that's low consistently over time, then they get put on something called levothyroxine, which is essentially synthetic thyroid hormone. And then, like we said last week, that's it. And it's outstanding amount of clients we see who, we ask them, so what's the plan? What do you do? What's the plan for the future now? And they just look at you rather blankly. And just assume that they just have to keep taking thyroid hormone for the rest of their life. And controlling the symptoms and getting adequate thyroid hormone for us is really, really important. Our body really needs it, so that's an important stage. But like we say always in functional medicine, the diagnosis and managing the symptom, it should always just be the start. So when we look at what we do in functional medicine, we really look at what influences, what is causing the thyroid to be underactive in the first place. So we have everything from inflammation, stress, high estrogen. Who knew high estrogen in the body could suppress your thyroid? Toxins, so that could be everything from fluoride. That's becoming more evident that fluoride can block the uptake of iodine, one of the most essential nutrients for our thyroid to produce thyroid hormone. That can also come from medication as well. So often things like oral contraceptive pills, beta blockers, omeprazole can all suppress the production and conversion of thyroid hormone. Then we have things like calorie deficit, which sort of makes sense. If we're not taking on enough food, our body's going to slow down to try and preserve energy. And this is exactly why people who go on calorie restrictive diets yo-yo all the time, because they train their body to work at a lower, more efficient levels with energy, and then when they start eating more, they're still in that state, so they start gaining weight and storing weight instead of using it because their metabolism is so low. And also liver and kidney function. So T4 will essentially convert to T3, and that actually happens in your liver and kidney. So everything is, the whole body is linked together, and we can't just look specifically at the thyroid. So if you consider like all these things can influence your thyroid, that's a huge conversation to have with someone when they present to you with a low thyroid. And just giving levothyroxine or thyroid hormone is not doing the service for that client in really getting them back to being well. Because if we give them levothyroxine and support thyroid function, but they've still got chronic inflammation, chronic stress, toxins going in the body, it's only a matter of time before that manifests as something else. So this is what we do as functional medicine. We really look at what the underlying causes are. So if we can address this, this is where this is going to balance out, and we really start getting to the root cause and guiding this person back to being well again.